Welcome to LifeStance Health special panel discussion in honor of World Mental Health Day. At LifeStance, we believe mental health is just as important as physical health. Our mission is to provide accessible, personalized, and compassionate care to individuals from all walks of life. Today, we've brought together a team of LifeStance Health clinicians to discuss critical mental health challenges, opportunities, and ways we can all advocate for better mental wellness. Let me introduce our panelists. First, Bill Franklin-Cromwell, social worker and specialist in trauma in Grand Rapids, Michigan. Dr. Joseph Fondries, psychiatrist and the regional TMS director in Upper Arlington, Ohio. Sabrena Ness, clinical counselor and regional clinical director in Windsor, Colorado. Dr. Tammy Torres, psychologist and director of integrated behavioral health in San Diego, California. And Dr. Monica Durham, psychologist and regional psychological testing director in Dallas, Texas. Thank you for joining us on this important day. Together, we'll be exploring ways to reduce stigma, increase access to care, and share practical tips for mental wellness. Let's get started. Why is World Mental Health Day an essential moment for LifeStance Health? And how does it align with our mission to make mental health care more accessible and personalized?
This is an essential moment for LifeStance because anytime mental health is being discussed in the world, awareness of mental health issues is growing and stigma is hopefully decreasing. And the greater awareness and the less stigma, the more likely people are to seek treatment from providers at LifeStance. And we have providers who speak many, many different languages. And we have translation services for languages we don't speak. And so externally, World Mental Health Day is an opportunity for us to say we are here, we are accessible, and we are personalized.
Why should mental health be treated with the same priority as physical health? How does LifeStance help patients prioritize both?
I'm obviously biased. I'm a psychiatrist, so I think that the mental health is everything. I view it as the mind's the control center of the body. So it's not such a far-fetched idea to think that if the mind is not doing well, maybe parts of the body will also not do that well. I think the answer to the question that I posed, why is mental health not a priority, is more or less because it's intangible. It is to see. Physical health is very clear. And if my kidneys are broken, maybe I have some physical symptoms. If I have pain somewhere, psychic pain is kind of not the same as physical pain. Anxiety, depression, these hurts, they absolutely impact people's quality of life. It impacts the economy. It causes days lost. This can be quantified. There's financial cost to all this. It's only recently that we've started to consider mental health as even a concept worth targeting.
What are the biggest challenges patients face when seeking mental health care, and how are we working to address these barriers?
So assuming patients can afford mental health treatment, the greatest challenge I see patients facing is navigating finding a provider who is a good fit for them. If you don't have insurance and you can afford to pay cash, finding a provider is as easy as a Google Maps search. But if you're using insurance, finding someone who takes your insurance, treats the thing for which you need help, and provides services in your location can be a nightmare. And if you need more than one service, like let's say you need testing for accurate diagnosis, you need therapy, you need medication management, you would have to go through this process 3 times. And it's a nightmare. So we're working to address these barriers at LifeStance by being a one-stop shop that matches people's insurance location and the services they need. We make finding a provider as quick and easy as possible. All people have to do is call our intake number and say, I need help for depression and PTSD. I live in Fort Worth, Texas, and I have Aetna insurance.
How has the rise of telehealth and virtual therapy at LifeStance expanded access to care, and what are the unique benefits for patients?
Certain patients are more able to have visits over the internet. It does require certain things that are not accessible everywhere. You have to have access to a phone. You have to have access to technology and a stable internet connection. But for some people, that's easier than having access to secured transportation, or maybe they themselves can't drive. I think the awesome part of it is that it is a second option, but it doesn't reduce the first option. We still always have the option for in-person visits. But how it positively impacts definitely people with transport problems, also rural areas.
Yeah.
That's a really big one. Ohio, as we all kind of know, has a few large cities and then many smaller areas. The awesome part of psychiatry is it does not rely on the physical exam as much as certain fields of medicine do. And I can do almost everything through a telephone or virtual visit as compared to an in-person visit. Almost everything is the same.
Given our work with diverse patient populations, how does the stigma around mental health manifest in different communities?
Yeah, this is a great question. Mental health stigma can be strong due to cultural beliefs. So, to view mental health issues as a sign of weakness or like personal failing. In others, it might be a lack of understanding about the mental conditions or mental health conditions, leading to misinformation and negative attitudes about mental health itself. Another area that I think is important is socioeconomic factors. They can play a really large role in how stigma manifests in lower income communities. This might be possibly due to like limited access to mental health resources,
right?
Which can contribute to that stigma, as people might not recognize or understand that their mental health what their mental health conditions are, or that they're even present. It also can cause some discrimination or lack of discrimination between different mental health things that are going on inside themselves, but also there's a lack of representation in healthcare in general, and that can exacerbate the feeling of being alienated or fear around seeking help.
Great. Oh my gosh. Thank you, Sabrena. Tammy, anything you want to add to that?
One thing I've noticed is I think a lot of people lack a vocabulary for emotions, for describing their emotional experience. And that I think also leads to a stigma of like, if I don't understand what I'm feeling because I don't have the vocabulary for it, how do I even seek help? Or like, is there something wrong with me?
What are some mental health resources, tools, or treatment options that LifeStance offers to support patients on their wellness journey?
So many of our offices have psychiatrists and psychologists, but we also have mental health nurse practitioners to help with med providers to help with some of those medications if needed. But then we also have a wide range of therapists that have different styles and techniques. And with and even some of our offices, not all of them, but a lot of our offices, some of our offices have Spravato. Different therapists provide EMDR, and other locations do therapy or group therapy.
Yeah. We also, some locations, as Dr. Fandrias will talk about, is offering TMS as well, transcranial magnetic stimulation too. Yeah. What are some actionable steps that our patients, partners, and clinicians can take to continue advocating for mental health and supporting those in need?
In terms of patient advocacy, what I would say is I'm a firm believer that the healthier individuals are, they go out and make their communities healthy. So the biggest thing you can do if you need help or you're looking for growth, stick with it, be consistent. No change is ever small enough. Everything adds up and has a ripple effect. And then from there, I would say, in a way, educate those around you on what you're doing and how it's helpful. So for example, if you're learning about boundaries, hold your boundaries and narrate them. Just kind of say, you know what, I've noticed that sleep is really important for me. I just can't go out after a certain time. right? It could be as simple as that, but other people in your community will start to notice, and that might be the motivation that they need to start making changes or outreach, or even know that it's okay to outreach, right? Like you're kind of being the example that resources are out there.
Nicolette, I was wondering if I could add one additional thing to that I think we haven't
Yes.
talked about is advocating for systemic change.
Oh, yeah.
Just want to mention one example here that we did in Utah is we recently had an important conversation with one of our state representatives about decreasing the barriers to accessing care to our clients. We specifically address access issues related to using insurance, which could prevent a lot of people from accessing mental health support that they need. This dialogue was from leadership. They put a lot of effort into, we went and talked to them about promoting more access to care. But it wasn't just the leadership involved, it was our clinicians. They played a huge role in the discussion as well. Their ground experience gave valuable insight into the real changes that we are facing and that we need to make when it comes to mental health in our system as a whole. So I wanted to add that because it's such an important piece what our clinicians can do as well. So.
What are some practical self-care strategies that LifeStance recommends to patients to help them manage stress and maintain mental wellness?
Yeah, well, here at LifeStance, we prioritize well-being for our providers first. It's a cornerstone of quality care for empowering them for our clients as well. But we do this by empowering the autonomy for them to craft their own schedules, to choose their caseloads. We also lay the groundwork, for them to provide that self-care for themselves, which I think is a huge part of providing it for their clients. This not only fosters a healthier work-life balance, but it also models effective self-care for our clients, which I think is important. It could even include just maintaining boundaries. Ending sessions on time can show that I'm taking care of myself, not answering emails, or we have AMD portal messages that we get from our clients, not responding to those outside of my hours that I work. And again, our clinicians get to choose their caseload. So I think or get to choose their schedule. So I think it's important, that they kind of set those boundaries with their clients, but that shows that they have a life outside of working with clients and starts that conversation around self-care.
So for me, self-care isn't just the act of doing your daily activities of daily living, like showering, those things. Sometimes it's reminding ourselves that our brains still need the time to play. Much like a child. So what are some of the things that we can do to do that? And maybe even if it's in a more adult way, such as combining different hobbies with different aspects of things that we used to do as a child.
What emerging trends in mental health treatment or research is LifeStance Health exploring? And how do you see these shape the future of care?
So this is really important for testing because the two greatest trends that, by testing, I mean psychological and neuropsychological testing, the two greatest trends that I see emerging in mental health care are an increasing need for providers who can provide services in other languages, particularly Spanish, and the increasing need for providers who specialize in the geriatric population. Both of these populations, Spanish speakers and older adults, are rapidly expanding. And I see efforts being made to hire people who provide these services, internally train current employees in working with older adults, provide language translation services, and I'm on a personal and professional mission as the regional testing director in the Central Region to expand testing services in Spanish.
Are there any advances in treatment methods or personalized care that LifeStance is focusing on to provide even better outcomes for patients, such as TMS or ketamine?
I would say the two biggest ones, these are a different, we'll say, wing of psychiatry. For the longest time, the gold standard of care was a combination of medications and psychotherapy. We now have this new branch that's brewing. I would just call it procedural psychiatry. those are two very good options. I myself have the great pleasure of working as a TMS physician. We've got a chair. It helps people a lot. We've had a lot of really good success. I was able to speak about that in times past. These are all just different options to fit different people's needs. I know essentially medications are very powerful, but they are all very specific. Something that's cool about TMS in particular is that everyone's left dorsolateral prefrontal cortex is about the same spot. I don't have to worry about, well, really, yes, left temple. And I don't have to worry about different degrees of liver sensitivity or different enzymes. All of that is sort of irrelevant with this procedure. That's a huge thing.
As we conclude our conversation, I want to thank you, Bill, Joe, Sabrena, Tammy, and Monica for such an insightful discussion about World Mental Health Day. We all can appreciate the key points that were covered, such as the importance of access to mental health care, decreasing the stigma, and the innovative approaches of TMS, integrated behavioral health, and psychological testing. We also can't forget all the helpful self-care tips and strategies that were shared as well. So thank you again for participating in this amazing discussion.